My name is Laura Rivera. Articulate health problems among nursing professionals and related factors. Authors, My Ara, Port Dignan, Marines Monteiro. Abstract objectives to know the health problems that affect nursing professionals, agency unit of the public hospital and their related factors. Without cross-institutional study wide 86 nursing professionals from hospital emergency unit in the countryside of the state of São Paulo, Brazil. They collect through questionnaires were analyzed using descriptive and interferential studies. Results of the professional report. Atlas injury or illness while medical diagnosis and 0.6% of the professional had two or more of diplomas with a mean number of injuries or illnesses of 2.8. The gross injury by accident and musculoskeletal disease were predomination. However, injuries in the back, gastritis or duodenal irritation, and hypertension were the illnesses with the highest number of reports. Nursing assistants or technicians presented on average more injuries or illnesses than nurses, as well as professionals with more than one employment, thus portrayed and or discouraged after work who has suffered occupational violence. Statistically, significant differences were observed between the group with or without injuries or illness in relation median sufferance age p equal 0.0075 and age and start of the activity p 0.0188 of workers. There was a statistically significant relationship between presenting an injury or illness and use of medicines p 0.0304. Conclusions. It is important that the institution provide working and organizational conclusion. It is important that the institutional provide working and organizational conditions for workers in order to enable them to maintain their health potential and skills for as long as possible. Keywords: disease, nursing team, emergency service, hospital, emergency medical, and service. Introduction. Nursing professionals generally compose the main bulk of the health workforce, being essential to health centers, clinics, hospitals, and other companies. His context assumes increasing importance in the face of the global nursing shortage and again of the workplace. The presence of some health problems can lead to short flows of attention that increase the risk of medication errors and many life-threatening future and other aspect-related patient safety. Method. A cross-sectional study was studied by 86 nursing professionals working in the emergency unit of a public hospital located in countryside of the state of Sao Paulo, Brazil. Their data were collected in the second half of 2016 from a set of instruments and questionnaire of socio-demographic data, lifestyle, health, and or spreads used in a previous study. The health area was used here to gather data on the position of the word, sex, worship, age, time of the word in the unity and in the institution. Age at the start of working activities, smoking habit, use of medication, fatigue, and or discouragement. After work, one while more than one job for overtime, good sleep, quality after work, and the skill level of worker. This level was assessed from a scale what white extremes from 0, I am fully stressed, to 10, I am not stressed. Method, the work ability index WAEA and finish questionnaire validate for use in Brazil what you sell to access the current illness with medical diagnosis self-reported by the professionals. Result simply consisted for 18 existing nurses professional, 23 nurses and 16 nursing technician of assistance, of which 68 79.1% were formal. Most of the professional workers the night shift, 31 38.8%, followed by the afternoon, 24 30.0% morning, 23 28.7%, and commercial 2 and 2.5%. Shift. These participants did not provide information about the work shift. Nursing professionals who have been victims of occupational violence, verbal abuse, sexual harassment, and or physical violence. In the 20 months period of the study had higher meaning the medical and burn injuries or illness than those had no and the difference was statistically significant. Discussion in the present study, the majority of professionals reported had lost one injury or disease or medical diagnosis, and among these, more than had reported having of two or more health problems. Musculoskeletal problems, including back pain, among nursing professionals are recurring use in students. The present study confirmed the predominance of injuries due to the accident and musculoskeletal disease in nursing professional of an emergency unit, revealing that injuries, the back, are the most frequent condition. Discussion. However, it's important to highlight the considerable frequency observed of the growth of disease of the respiratory, digestive, cardiovascular, endocrine, and our metabolic system, followed by the other conditions that were identified in a small number and in the present study. Nurse vulnerable to this consequence by considering the continuous exposure, the work stressors, especially in the case of nurses in the emergency setting who are exposed to stressful, agitated, difficult to predict, and ever-changing situations that contribute to high occupational stress in this area and they makes this especially different from the others. Discussions. A prevalence of occupational violence toward nursing professionals in emergency settings is also frequently reported in the literature, as well as the fact of these events in the health of the workers who were. Conclusions. The study relevance that's important and of implementing the workplace to reduce the number of injuries or disease among nursing professionals, considering the identification of the among professionals and the musculoskeletal issues is now recent. It's important that the institution provide working conditions that allow the health maintenance potential and the skill of this professional for as long as possible so as promote both their quality of life in the short and long term in the quality of care provided. Thanks.